Okay, so today we're going to talk about introduction to the skeletal system, and we're going to talk a little bit about the different characteristics of the skeletal system, and then understand that we have two different sections of our skeletal system. We have what's called the axial skeleton, and then we have the appendicular skeleton. So today we're going to learn about the axial skeleton, and then tomorrow we'll learn about the appendicular one. So we're going to learn about the spine, head, the ribs, but then the appendicular skeleton tomorrow will be about the arms and the legs, the appendages. So as we go through, we have 206 bones in our body, but we're not going to necessarily have to learn 206 different names. So I'm going to go through and I'm going to share with you kind of the major ones that we're going to need to know. So as we look at the quick little video here of the skeleton. The idea is you should be able to understand this by the time we're done with the skeletal system. So this is one thoracic vertebrae. Okay, so we have 33 total vertebrae in our body. This is one of them. They have different shapes. There's different sections of our vertebrae. So this is a thoracic vertebrae. They're one of 12 thoracic vertebrae. And they are all matched up here. We call the first one T1 for the first thoracic. Second one would be T2 for the second thoracic. T3, T4, T5. These are where our ribs attach to. And all these areas in the back is where all the muscles attach. These are called our processes. So transverse processes on the sides, and then spinous processes is that what you feel of the spine. So that's just one part of it. As we look at the entire spine, it has these curves to it. We have the top section, which is our neck, called cervical vertebrae, thoracic. We have 5 lumbar vertebrae. Down, that's our low back, is our lumbar vertebrae. Look at the difference, how big they are, compared to those ones up at the top of our neck. We have 7 cervical vertebrae up in our neck. Very different shapes, but they're all vertebrae. They have space between them because they have that intervertebral discs. You can see now they're filled in. They cushion it. You can also see we have our sacrum, which is this fused vertebrae that forms the back wall of our pelvis. And in the very bottom down there, that's our coccyx. And our coccyx has 4 little fused bones together, even like the tail. It's an extension of when we used to have tails. We have our ribs. We have 12 pairs of ribs, all connected to the sternum in the front and connected to those thoracic vertebrae on the back. You'll see in the bottom there's 2 floating ribs. Some of them have this arch called the Costal Arch. They all go and attach to the sternum. And then we also have our pelvis. That's all part of our axial skeleton. All right, so our pelvis here is actually 3 fused bones on one side, 3 fused bones on the other side. We'll learn those 3 bones: ilium, the ischium, and the pubis on the right side and the left side. If you look at our shoulder blades up here in the top now, as we get into the appendicular skeleton, that is called our scapula, and it's a pretty funky shaped bone, and it has a joint both with the arm, the humerus, but also with the ribs. We also have our clavicle, which is our shoulder blade, goes across and attaches to our sternum in the front. Our upper arm bone is called the humerus, and it is the largest bone of our upper body. It forms the shoulder joint at the top, and it forms our elbow joint at the distal end. Our elbow joint then does 2 things. One, it does flexion and extension. That bone that does it is the ulna. The other bone that meets it is the radius. So we have 2 bones of our forearm, what we call that. The radius helps us rotate, right? So radius means goes in a circle, and that's what allows our wrist or our arm to do. And then the other one allows it to bend like a hinge. We have 8 carpal bones of our wrist. We have 5 metacarpal bones of our hand, and then we have 14 phalanges of each fingers of each hand. So we have 8, 5, and 14 on the right side, 8, 5, and 14 on the left side. And we don't learn the names of those carpal bones in Sports Med 1, but we'll learn them in Sports Med 2. As we start going to the lower body, we have our femur. You'll notice our femur has this angle where it goes into our hip. It goes into our pelvis and forms the hip joint. We don't have a hip bone. We have a hip joint, and it's formed between the femur and the pelvis. It's the largest bone in our body. It's the longest one. It's also the strongest one. So whenever you hear about someone who's broken their femur, realize that that's probably a very serious injury with a lot of force to break that one. Our lower leg, the main bone is called our tibia, and 95% of our weight all goes on the tibia. Our ACL holds our femur and tibia together. We have cushioning between that knee joint called the meniscus. But we also have a second bone of our lower leg, and that is called the fibula. And that's this little bone on the side. And that's the way I remember it. Fibula is L for little. And that's more for muscle attachment than anything else. I've seen people be able to walk or run or jump, and they have a fibular fracture. The other thing we can't see on here too well is the bones of the ankle. Here they are. They're coming on a little bit, right at the bottom of the screen. But we have 7 tarsal bones. They form our ankle joint and our foot. And then we have 5 metatarsals and 14 phalanges, just like our hand. So we have 7 tarsals, 5 metatarsals, and 14 phalanges of each foot. So those are the bones of our body. Oh, the one thing I didn't mention is our kneecap. It's called our patella. It is right here. It's that what we call a sesamoid bone. And we'll talk more about sesamoid bones in a minute, but it's right on the front. And that's all the bones of our body. So we have them all there. That's the 206 of them, and that's what we're going to learn. Along with the bones of our skull, we're just going to learn what they are. We're not going to go into a lot of details about them, but we do have quite a few bones of our skull. As we go through the skeleton this next week, the goal is to be able to look at that video and be able to say what they are. So we have 5 functions of the skeletal system, and we talked earlier about the main 3 of them, but there's a couple other ones as well that we didn't get into details earlier. So first one is movement. Obviously, our skeletal system is going to work with our muscular system to provide movement. If we didn't have our skeleton, it'd be really difficult to move. It would be like a worm. Okay, we just kind of inch our way along, or a slug. It provides support. So it holds us vertical. Our spine supports our head, or our cranium. Protects our spinal cord. Lots of support for muscles, for everything else as well. Protection. Our ribs protect our lungs and our heart. Our skull protects our brain. There's multiple things going on that help with protection. Our skeletal system is also responsible for making blood cells. So red and white blood cells are formed in the bone marrow, which is in the spongy bone. So there's a lot of space in there. That's where it's formed at. Our body's continually making new blood cells, especially red ones. Really important, and that's all happening in the bone marrow. And then the last and 5th function of the skeletal system is storage. So it's going to store minerals. And we've talked a little bit about this, that right now in your teens, 20s, you're adding calcium, potassium, magnesium, all these minerals to your skeletal system and making it really, really strong and really thick. And this is important because once we get into our 60s and 70s, our body's actually going to start taking those from storage to be able to help. Our body just doesn't become as efficient as we get older, so it's going to start using those stores that are stored up. Usually in our 30s and 40s, it's just it doesn't get worse, it doesn't get better. And so that's where we talk about as a kid or when you're younger, drinking milk to help develop good, strong bones. It's all about providing enough vitamin D with the calcium. There's multiple things that a good diet is important for to help our body store as many minerals as possible. Make your bone as dense and as strong as possible. And so what we do is we'll see people that are malnourished or don't have good nutrition. They tend to have a lot more fractures because of that. Okay, so we have two major skeletal systems. Everything you see here in blue is our axial skeleton. Axial skeleton is our skull and our head, the spine, the ribs, and the sternum. And that's it, 80 bones. And then our appendicular skeleton we'll deal with tomorrow. It's everything in white. And that is the appendages. Okay, so it's our shoulders, our arms, pelvis, and legs. So today we're going to learn about what's in blue, because that axial skeleton. 80 bones. When we talk about bones, they usually fall into four main categories of bone shape. What you think of as your arms and your legs and your fingers are what we call long bones. Okay, so they have an end at each end. They usually attach to something, and it provides height. It provides your arms to be long, your fingers to be long. Those are all long bones. We also have short bones, and these are more, think of them like dice or cubed type, or ice cubes type of shaped bones. They could be a little roundish, they could be a little squarish, but they don't really have a two ends. They kind of just are more of a block shape. We have these in our wrists and our ankles, so our carpals and our tarsals. We also have flat bones. These help protect, offer a lot of protection. So our skull is flat bones, our sternum, our ribs, our pelvis, all those are flat bones. And then irregular bones, and these just don't fit into a category one way or the other. So our spine, and you saw that from the very beginning of that video, very funky shape. There's a couple other bones as well that kind of have just funky shapes to them. We actually have bones in our ears, and those bones in our ears are funky shaped as well. So they're called an irregular bone. When we talk about the structure of a bone, there's 4 layers of it. And the most outer layer is what we call the periosteum. And this is more just like a saran wrap, protective coating or sheeting that's wrapping our bone. It allows muscles to kind of attach to that periosteum. That tendon attaches to that part. It helps kind of seal and protect the bone. If you've ever eaten ribs or eaten meat where it comes off the bone really cleanly, that's because you're actually pulling the periosteum off the bone and not just the muscle itself. So we see that a lot if you're eating like chicken or eating ribs, or sometimes it'll come off really cleanly, and that's because you're actually pulling off that periosteum. The compact bone is what we think of as the hard part of our bone. It's not, our bones are not the same all the way through. We have the spongy bone in the inside. So the compact bone is this outer layer that's really strong and really dense. And then the inside of that is spongy bone. And this is not soft like a sponge. It just has holes in it like a sponge does. But it's still made out of bone structure. It's still very hard. And so this is what we work on during your teens and your 20s, about adding as much density to that spongy bone as possible, because later in your 60s and 70s it takes minerals out of your spongy bone. When that happens, it's called osteoporosis. Maybe you've heard of it. So usually as we get older, that weakens our bones and weakens that internal structure of it. And then in that spongy bone is we have bone marrow. And this bone marrow is yellow marrow, which is fat, red marrow, which is the blood cells, and that's all happening in the bone as well. You'll notice in this picture, they talk about the epiphysis and distal epiphysis, proximal epiphysis. That's where your growth plate is. So as you get out of your teens, into your 20s, that growth plate's going to close up and it'll look solid. But when you're younger, it'll actually look like there's a fracture across there. That's not a fracture. It's the growth plate, and it's an open gap area where it keeps filling in new bone into that epiphyseal area and adding more length, kind of building like bricks or building blocks, where it's just adding to it and making that bone longer and longer. So when we talk about the axial skeleton, we're not going to learn right now. We're not going to learn the names of the cranium, the face, and the ears, but just know that of our skull, there's 8 bones of our cranium. There are 15 bones of our face called facial bones. Almost all of these are fixed, meaning they don't move. There's only one that moves, and that's our mandible. It's our jawbone. But all the other ones are fixed and they don't move. And then we have 6 bones of our inner ear, 3 in one ear, 3 in the other ear. And those little bones actually help us hear. They're the smallest bones of our body. So just know that. Okay, so we have 8 bones that protect our brain, form our skull or our cranium. We have 15 bones of our face, and we have 6 bones of our inner ear, 3 on each side. When we talk about the vertebrae, also called the spinal column, the vertebral column, we have 33 vertebrae, and we break it down into 5 different sections. And this picture doesn't do a great job of it. They show the 3 main ones. But over here, you'll see A, B, C, D, and E. And D and E are both red, but it's actually 2 different sections there. So let's talk about these. Okay, so section A is what we call our cervical vertebrae. These are of our neck. We have 7 of them. And they're shaped a little bit differently than the other ones. With these cervical vertebrae, we have the first one is called C1. The second one is called C2 for cervical, C3, C4, C5, C6, and C7. So that's how we name them, and it stands for first cervical, second cervical, that type of thing. Now we also have special names for the first 2, atlas and axis. So the first vertebrae, C1, is also called atlas. And the reason why is because that's Greek for the Greek god that holds up the world. If you've ever seen like the statues of him holding up the world, his name is Atlas. And the same thing, our spinal column is holding up our skull, which is the whole world, right? Everything happens in our brain. The second one, our C2 vertebrae, it's specially shaped, and it allows for pivoting. Shake your head no happens between C1 and C2. And so that's called the axis. So it's rotating on the axis of that C2. And there's a special anatomy to it, and we're not going to get into details of that here in Sports Med 1. But just know that those 2 vertebrae have special names. C1 is called the atlas. C2 is called axis because it rotates. We have 12 thoracic vertebrae. Those are the ones of our ribs. It's all in blue right here. The ribs attach on the backside to these thoracic vertebrae, and they attach on the front side to our sternum. We have 5 lumbar vertebrae. This is in yellow. The lumbar vertebrae are very, very thick, very strong. We don't see a lot of injuries to our lumbar vertebrae, but because they're so big and so strong, they tend to put a lot of pressure on the what we call the intervertebral discs, these cartilage cushion between each of the vertebrae. And so a lot of times we'll talk about having a herniated disc, or you hear about someone blowing out their back or blowing out their discs. That's usually their low back of the lumbar vertebrae. And then D is 5 vertebrae of the back of the pelvis called the sacrum. These are fused together. They don't rotate. They don't move. It's the back wall of our pelvis. And then the last part, E, the small little thing here, there's 4 little fused bones called our coccyx, C-O-C-C-Y-X. And these are remnants we think of when we had tails. And that's what's left of it. So it's our tailbone. And they're fused together. They don't move. And those are all fused together, but they have different shape to them. So that's why we call it. So 33 vertebrae. And you have to know the different sections of them and how many are in each section. Here's another picture, kind of a close-up of that sacrum and the coccyx, so you know a little bit more how it looks. See how it's fused together, but you can kind of see that your first... Oh, and one thing that I didn't say was each of these, just like our cervical vertebrae, they're abbreviated. So our thoracic, T1, T2, T3, T4, T5, T6. Sacrum, or sorry, lumbar, it would be L1, L2, L3, L4, and L5, short for that. And when we get to the sacrum, it's going to be S for sacrum. So this will be S1, will be this section here, S2, S3, S4, and S5. But they're fused together and they don't move. These little holes here for the nerves to come through, and they kind of separate each of the vertebrae, or at least gives it some delineation. You can see here a close-up of those intervertebral discs. They're white, and that's white cartilage. We have nerves that come out in between each of these vertebrae. And then the last thing is your coccyx. And we don't really abbreviate the coccyx. Like this is first one, second one, third one, fourth one, but they're so small that it's really hard to differentiate between any of them. So that's just our coccyx tailbone. Now, when we talk about ribs, we have 12 pairs of ribs. Now, one of my big issues is I always forget to call them pairs. So whenever I'm talking about the ribs, I say we have 12 ribs. So if I say we have 12 ribs, what I really mean is we have 12 pairs of ribs. And they exactly match right side versus left side. But they're not all the same. Our first 7 ribs are what we call true ribs. And all of them start on each vertebrae, right? So we have first rib starts on our first thoracic vertebrae, comes around and attaches directly to our sternum. Our second one starts at T2, the second thoracic vertebrae, comes around, attaches to our sternum. Third one, fourth one, fifth one, sixth one, and the seventh one starts at T7, seventh thoracic vertebrae, comes around and attaches directly to our sternum. So those are true ribs. But then we have 3 what we call false ribs. And what that means is so the 8th rib starts at T8, the 9th rib starts at T9, 10th rib starts at T10, and they wrap around, but rather than attaching to the sternum, they attach to the 7th rib. That's what we call the costal arch. You see all this white stuff here? This is all cartilage. It's what allows our ribs to flex and move, to expand when we breathe. So that is all costal cartilage in there. We can get fractures of our ribs, but oftentimes what happens is we get separation of the cartilage from our ribs. But this is what allows it to flex and bend. You get, landed on in football or in wrestling. It prevents them from breaking all the time. So that's 10 ribs. And then the last 2, they attach. So the 11th rib starts on T11. The 12th rib starts at T12. But they just come about halfway around and then stop. They don't attach to anything. So they're called floating ribs. And they're there to help protect our organs. When we talk about bones offering protection, they're there to help protect our lungs, our kidneys, our liver, our spleen, all these abdominal organs we're going to learn about later. Those are all in that area, and so those ribs help protect it. And then the last thing about our axial skeleton that we need to know is about our sternum. Our sternum has 3 parts to it. This first part is called the manubrium. So the manubrium is where the clavicle attaches. We'll learn about the clavicle tomorrow. And where our first rib attaches. You can see that right there. Okay, and this is blue. That's showing that costal cartilage. The second one is what we call the body of the sternum. And that's normally what you think of as your sternum. You can actually, going back a little bit to the manubrium, you can actually feel this, what we call Manubrial Notch. It's right at the bottom of your neck. If you feel right there, you'll feel a little groove. That is your Manubrial Notch. And then right below it is where the body of the sternum starts and goes all the way down, and that's where all the ribs attach. Right? So all 7 ribs attach to the body, the 2nd through 7th rib, all attached to the body of the sternum. And then the xiphoid process is this last little part down here. No ribs attached to this. Starts with an X, but it sounds like a Z. It's called the xiphoid process. And you can feel that. Feel right at the bottom of your sternum. You'll feel a little bump there. This is your xiphoid process. This is where a lot of your abdominal muscles attach. to your ribs and to your xiphoid process. So it's there for muscle attachment. We have to be careful when we get into CPR that we don't break that xiphoid process. So one of the things we'll talk about is making sure that we do CPR right in the middle of the body of the sternum. We don't want to go down by that xiphoid process and break it. And tomorrow we will talk about the appendicular skeleton and everything else that goes along with it.